Elon Musk is leaving the Trump administration, but there are social security changes that he wants to make before April the 14th. What happens to those changes? I want to bring you the full details of this breaking news. And I want to go into details of what these changes are about. You may not have received anything in the mail announcing the drastic changes that are happening on April the 14th, but they're going to happen. They're going full force. And I want to bring you up to date, but most importantly, show you what you have to do in order to prepare, because this is going to affect how you deal with the Social Security Administration regarding your benefits. And then there is a surprise check in the mail. If you've received $6,000 in your bank account or about, it is not a fluke. This is real. The government is paying 3.2 million people back pay of an average of $6,000. I'm going to give you the details about that. We've been hearing from a lot of retirees who've gotten the pay in their bank account and are wondering what this cash is about, what this extra money is about. I have all the details for you. Now, watch till the end of this video because I have some news about Medicare. Now, who am I? I am Kwame Kwade. I am an entrepreneur and personal finance expert. For over 15 years, I have been creating content to help seniors get the benefits they deserve. I started building websites on Social Security, food stamps, Medicare, Medicaid, and we have recently branched into video content to be able to bring you more breaking news and updates. I am also an adjunct professor. I teach entrepreneurial finance at one of the most prestigious universities in the United States. And so if you're new to this channel, hit the like button, hit the subscribe button, because we appreciate your support. And as always, I want to know where you're watching this video from. Go into the comment section and let me know your city and your state. So let's dive in. So Elon Musk is leaving. What are these new rules that he wants to implement before he gets out? Let's talk about it. So these Social Security rules, you may not have received anything in the mail, but they are happening. Why? Let's talk about it. Major Social Security policy changes are here and they will affect you. The changes are critical for all beneficiaries to understand, ensuring they don't face unexpected disruptions. The new in-person identity verification rule will now take effect on April the 14th. It was originally scheduled to take into effect on March the 31st. They gave it 2 more weeks. The delay offers additional time for seniors and other affected individuals to prepare for the new requirements and understand how they might be impacted. So who is affected? Well, everybody on Social Security and Medicare, but there are people who are exempted. So Medicare, disability, and SSI applicants are exempt from this in-person verification if they cannot complete the process online. Why does this matter? Why should you care right now about this new rule? Well, this is going to change how you deal with the Social Security Administration. If you want to change your direct deposit information, if you're applying for benefits, if you want to update your information, now they are moving a lot of people to come into the office. If you cannot change, make your change online by verifying your identity. So let's walk through what this means for you. Well, the the in-person verification rule, retirement and survivor benefit applicants must verify their identity in person if unable to do so online. This requirement aims to reduce fraudulent claims, but could also place a burden on those without internet access. And then there's overpayment. Starting March 27, which has already happened, Social Security Administration will withhold 100% of benefits to recover overpayments for new cases. This change in policy significantly increases the financial impact on beneficiaries who receive overpayments requiring immediate and full payment. Now, why should you care about this overpayment issue? Well, it's because it's affecting a lot of people and they may not be aware that they have an overpayment situation until they get a letter in the mail and their benefits will already have been cut, and then they are not able to do anything about it because the government is going to hold your benefit until you've paid back all the money that. Another change happening is related to cost of living adjustment. You probably have seen that already. Starting in January 2025, your Social Security benefits went up by 2.5%, which was on average $40 a month. And if you're on disability SSI, it was $29 a month. And if you're on SSDI, it was about $34 a month. But the biggest news is staff reductions and office closures. The Social Security Administration is cutting thousands of jobs and closing field offices, impacting customer service availability. As a result, beneficiaries may experience longer wait times when seeking assistance with their benefits, further complicating the process. So, who is affected by all of this? Let's talk about it. Well, those applying for retirement benefits or auxiliary benefits must verify their identity in person if online options fail. So I want to be clear on this. This is a list of the people who are directly affected by the rules that are coming in on April the 14th. The new rules adds a layer of complexity, especially for those unfamiliar with online processes or who lack reliable internet access. Now, people who are in overpayment situation are also affected. Anyone receiving an overpayment after March the 27th will face full benefit withholding until repayment is complete. This abrupt change from the previous 10% withholding can create significant financial strain, particularly for those relying on Social Security for essential needs. And then SSI recipients are going to see more scrutiny. SSI recipients undergoing redetermination audits will see stricter eligibility checks. These audits could lead to benefit adjustment or termination if income or asset criteria are not met, affecting vulnerable individuals at a critical time of their need. And then if you have online access or you don't, then this is time to pay attention. Seniors without access to SSA's online system may face longer wait times or travel burdens. Lack of internet access will force these seniors to rely on in-person services, which are becoming less accessible due to office closures and staff reductions. So let me summarize this. If you're applying for benefits, Social Security and disability benefits, or Medicare, you have to verify your identity online. If you cannot do so, you have to go into the office and complete the application. If you're currently receiving benefits and you want to change your direct deposit or some other information, you will be required to verify your identity online to say that you are who you say you are. If you cannot do that, then you have to go into the office. Those are the big changes that are coming on April the 14th. So, how can you deal with it? Well, those who are not affected are Medicare, disability, and SSI applicants who are exempt from the in-person ID verification requirements. Now, if you're currently getting overpayment and you're on a payment plan, then you're also exempted. So those already repaying overpayments at the 10% rate will not be affected by this new policy. This provides some stability for beneficiaries who have already established a payment plan under the previous guidelines. And then they're trying to do something for survivor benefits. This is a future goal. Further exemptions may be announced for elderly surviving spouses filing for survivor benefits. SSA is considering expanding the exemptions to further minimize disruption for vulnerable populations during difficult times. And then, who is not affected at all by this? Beneficiaries already receiving Social Security payments do not need to visit SSA offices or provide additional verification. So if you're currently receiving benefits and you don't need to update your direct deposit or change anything about your case, then you don't have to do anything. But if you're currently receiving benefits and you need to change your direct deposit and you're not able to do it online because you couldn't verify your identity online, then you have to go into the office to do that. So when current beneficiaries must visit SSA office. So if you're currently receiving Social Security benefits, when do you have to go to the office? Well, starting April 14th, current beneficiaries who cannot use their Social Security online account to change direct deposit information must visit the office in person. And then if for whatever reason they need you to verify your identity online and you cannot do that, then you have to go to an office. So that is critical information. Now, preparing to avoid in-person visit for current beneficiaries. If you're currently receiving Social Security and you want to avoid getting hit by this new rule on April the 14th, yes, here is what you have to do. Set up an online account at ssa.gov/my account to access and manage your benefits digitally, reducing the need for in-person visit. Also verify your identity online using login.gov or id.me to verify your identity, ensuring continuous access to your Social Security account online. Update your information to make sure that the Social Security Administration have your current email address, your current address, mailing address, so that everything online looks good. And you can also opt in for online notices so that you can get notifications quicker without having to wait for the mail to come in and then you'll be asked to come to the office. So what actions can you take before April the 14th? Well, number one, if you're applying for benefits, set up your My Social Security account online immediately before April the 14th, because that gives you room to do everything you need to do, verify your identity, get everything set up before these new rules go into effect. And if you're currently on benefits and you need to update your direct deposit information, do it now, because that saves you the hassle of having to do it under the new rules that go into effect on April the 14th. And then if you have to go to the office, the Social Security office, for whatever reason, schedule your appointment now so that you are not part of the mad dash that's going to happen after April the 14th. And if you are stuck on any particular issue with the Social Security Administration and you're frustrated that they are not helping you, then you can contact your elected representative, your senator, your congressperson, and have them intervene on your behalf. They can be very helpful in these situations to help you when you're trying to deal with the Social Security Administration. Now, let's talk about overpayment, because there's a lot going on with overpayments, and I want to bring your attention to that. The Social Security Administration will now withhold 100% of overpayments to recover any amount you owe after March the 27th, reversing a prior cap of 10%. This will cause financial hardship for seniors relying on Social Security as their primary income source. The sudden loss of their full benefit can lead to difficulty covering basic expenses such as housing, food, and healthcare. Now, the policy, this new 100% policy, is expected to save $7 billion over the next decade, which is a drop in the bucket for the Social Security Administration. So I'm not even sure why they are trying to put this burden of trying to claw back 100% of overpayments when previously the policy was 10%. But you can appeal. If you get into an overpayment situation, you can appeal to the Social Security Administration. They rarely grant appeals or waivers, but it's worth the shot if you feel you have been unjustly targeted. And then if you're on SSI benefits, expect that there'll be more redetermination audits to make sure that you are indeed disabled and deserve the benefits you are receiving. The frequency of these redetermination would increase, and just avoid disruptions, make sure that you are taking care of what they need you to take care of, responding to notices, and providing the information to the Social Security Administration that they've asked you for, because it's going to help avoid any delay in your benefits, because these redetermination can lead to a loss of your benefits or a reduction of your benefit depending on what they find. So, what I wanted to share with you regarding this particular rule, stay tuned. I have something about Elon Musk I want to share with you, is that starting April the 14th, the new ID verification process goes into effect. If you're currently receiving benefits and don't have to change your direct deposit information, then you're good. You don't have to do anything. But if you're trying to apply for Social Security or disability, you have to verify your identity online as part of the application process, or you would have to go to the office for help. So let's talk about Elon Musk. This came out. Trump is telling his inner circle that Musk will be leaving the government soon. This is a big deal. Elon Musk joined the Trump administration as a special government employee to lead the Department of Government Efficiency, tasked with cutting waste and reducing the federal deficit. His efforts have been praised for identifying is the key phrase, $1 trillion in savings. Musk's bold and coordinated actions, such as unexpected agency cuts and public statements, have caused friction with cabinet secretaries and staff. His unpredictability has made him both an asset and a liability, and his outspoken comments like calling Social Security a Ponzi scheme have sparked backlash, undermining Trump's promises to protect entitlements. His actions have rallied Democrats and divided Republicans. President Trump recently confirmed Musk will step back from his role in late May or early June, transitioning into an informal advisory position while returning to focus on his businesses. Musk's 130-day tenure as a special government employee is set to expire, marking the natural end to his former role in the administration. This status exempted him from certain ethics and conflict of interest rules. Cabinet secretaries and Trump insiders have struggled with Musk's lack of communication and off-message actions, including decisions that blindsided senior staff and caused political fallout. Trump is focusing on maintaining GOP unity ahead of midterms and minimizing distractions caused by Musk's controversial style. This transition allows Trump to distance himself from potential political blowback that may have come or will come as a result of all the action that Elon Musk has taken. Musk has publicly stated that his primary goal, reducing the deficit by $1 trillion, has been achieved, signaling it's time for him to move on. So he's identified areas to reduce the deficit. Whether they're going to follow through or not is another question. So what happens next? Musk is expected to return to an informal role as an advisor to the president, occasionally appearing at White House events while focusing on his private ventures. Trump has shifted responsibility for agency cuts back to cabinet secretaries, signaling a more traditional approach to governance without Musk's direct involvement. While Musk's departure may ease internal tension, his polarizing presence has left lasting impact on Trump's administration, energizing critics and complicating GOP messaging. Now, what is his legacy? Well, despite controversies, Musk's work with DOGE has been hailed by Trump as revolutionary, leaving behind a framework for future government efficiency initiatives. So let me know what you think. You know, he's been very controversial, but he's done a lot of cuts and closed a lot of departments and, laid off a lot of people, closed a lot of offices. Do you think Elon Musk has been effective with DOGE, and especially the changes that he's trying to make on Social Security, some of which are coming into effect on April the 14th? Let me know what you think in the comments section below. And let's talk about the $6,000 surprise checks that a lot of seniors have received in their bank accounts and in their mailboxes. So, why are some seniors receiving $6,000 lump sum payments? Well, this new law, the Social Security Fairness Act, repeals the windfall elimination provision and the government pension offset, which previously reduced Social Security benefits for retirees with non-Social Security pensions. The repeal ensures that these retirees receive benefits they were unfairly denied. And then there's retroactive payments. Eligible beneficiaries are receiving lump sum payments averaging $6,710 to compensate for lost benefits from January 2024 onwards. These payments are automatically deposited into recipients' accounts by the end of March and continuing into April. So who qualifies for this lump sum money? Retired teachers, firefighters, police officers, federal employees under the CSRS, and others impacted by the WEP and GPO are all eligible for these payments. Beneficiaries tied to foreign service Social Security systems also qualify under the new rules. And then on top of the lump sum, there's monthly payments. Starting April 2025, affected retirees will see their monthly Social Security check increase by up to $1,000 or more, reflecting the removal of the WEP and the GPO. So what is the Social Security Fairness Act? The law removes provisions that reduce Social Security benefits for retirees with pensions from jobs not covered by Social Security. This correction addresses long-standing inequities in benefit calculation. It's been a 40-year fight. More than 3.2 million retirees, including teachers, firefighters, police officers, and EMS providers, will benefit from this change. These groups often face reduced benefit despite earning pensions through years of service. They've worked in the government and earned their government pension, but they've also worked in private sector jobs and earned their Social Security benefits, but they were either denied the Social Security because of a law that was passed in 1983, or they were severely reduced for their Social Security benefits. The retroactive benefits cover benefits they lost since January 2024, ensuring affected individuals are compensated fairly for the past year of withheld funds. This expedited payment process marks a shift from previous delays in retroactive payments that the government has issued in the past. So, who is eligible for these payments? Well, public sector retirees are eligible. Federal employees under CSRS are eligible. Foreign pension holders, individuals whose employment was tied to foreign social security systems also qualify. And then survivors and surviving spouses whose benefit were impacted by GPO will receive retroactive payments and increased monthly checks starting in April 2025. How far back do these payments go? Well, as I mentioned, January 2024 is when they're going to go back and pay you the money that they withheld. The average amount is about $6,710. That's why people are seeing about $6,000 checks in their bank account. And then you don't have to do anything. All of this is done. The Social Security Administration has all the information they need to make this happen. So no action is needed from your end. But if you're impacted, you should have received at least your lump sum payment. But if you don't get the lump sum in April, then you should contact the Social Security Administration. But your new monthly payment, because of the repeal of the GPO and the WEP, that new monthly payment, the higher Social Security check you're going to get is going to start in April 2025. So you don't have to do anything. Make sure your direct deposit information with Social Security is updated. And if you have any question, call the Social Security Administration for any help that you need regarding how much money you're going to get because of the repeal of the GPO and the WEP, and when your new monthly payments are going to hit your bank account. Now, let's talk about Medicare. If you're turning 65 or are already on Medicare, you need to pay attention to this. 1 million patients lose coverage as insurance and hospitals drop Medicare Advantage plans. If you're applying for Medicare or turning 65 and you're thinking about Medicare, there's a lot of information you need to be aware of. Part of it is that there's 24,000 Medicare plans out there, and it's so hard for seniors to pick the right plan for themselves. And that's why 90% of all seniors are in the wrong Medicare plan. Here you're looking at Oregon, where 25% of plans are leaving the state. You have Minnesota facing the same problem. And that's why the Center for Economic and Policy Research put this thing out. 34 million seniors on Medicare Advantage plans face rude awakening. So what is this all about? It's confusion around Medicare because it's so complicated, and 24,000 plans out there. How do you know what is right for you, your budget, and that meets your need? And so a lot of seniors are on the wrong plan, and it's costing them a lot of money. The average senior couple spends about $300,000 on Medicare during their retirement, and it's costing you your health because access to the right services at the right time is essential. And when you don't have them, or you don't know that your plan was dropped, or your doctor was dropped, or your medication is not covered, that becomes a problem. And that is why we have partnered with Chapter. Now, this is not another Medicare advisory firm. Chapter started because one of their co-founders had a problem. He was trying to help his parents sign up for Medicare, and it was the experience that his parents went through that made him realize that there was a problem that needed to be solved. And so their mission is to help you get into the best Medicare plan available to you. They are the only advisory firm that have access to all 24,000 Medicare Advantage plans or Medicare plans that are out there. And their service is free to you. You don't have to pay anything. And their agents, their licensed advisors, do not work for commission. So when they get on the phone with you, they are not trying to sell you the most expensive plan because they're going to get commission. They're trying to find the plan that fits your need, your budget, the coverage you need, and more. And they can save you up to $1,100. If you're applying for Medicare or you're currently on Medicare trying to figure out if you can get on a better plan, these are the guys to call. 539-205-2147, or go into the comments or the description to this video. There is a simple form that you can fill out, and then they'll reach out to you. Guys, these guys are the real deal, but you have to act soon. And they are highly rated by the Better Business Bureau, A+ rating, a lot of 5-star reviews. Check it out for yourself. Call Chapter today at 539-205-2147 and get into a better Medicare plan that works for you and save some money in the process. So that is all I have today for you. I hope you found value in this presentation, and let me know in the comments what you think. And until I see you in my next video, thank you for watching.